This is not a normal part of the healthcare system, but these aren't normal times.
In TB area?
This community center's been turned into a makeshift isolation center, a place for homeless people acutely at risk.
It's not possible to create physical distancing in the shelters as they currently are, and it's certainly not possible to allow people to isolate in the shelters.
It's happening across the country.
We are preparing for every eventuality.
Piece by piece, Canada is readying itself for a worst-case scenario, a potential surge of COVID-19 cases.
It is appropriate and necessary that we look at how to expand our health system to handle unprecedented numbers in an unprecedented crisis.
Across the country, provinces and territories are preparing.
Local governments are being asked to identify and make available any publicly owned facility that may be used for pandemic response, including facilities for self-isolation, medical care, and testing.
Hospitals in Quebec are freeing up beds by using empty hotels to house patients with other conditions. Ontario's considering treating people in heated warehouses and garages if hospitals become overwhelmed. And Edmonton's already using its expo center as a drop-in for homeless people and considering using recreation centers as field hospitals.
We've seen horrifying accounts of, ice rinks converted to morgues in Spain, and we all want to avoid and stay ahead of that.
The advantage for Canada is that it has time to prepare and living examples to learn from of worst-case scenarios unfolding in other areas of the world. This week could be key. It's the first time Canada could see the effect of so many snowbirds and spring breakers traveling home, and if they actually listened to public health advice. Ashley Burke, CBC News, Ottawa.